Good evening. Welcome to the DigiSeminar of the Philippines KL Samfoni Norge, FHS, in collaboration with Cancer Registry of Norway. I'm Florencia, a volunteer and the Program Secretary for Multicultural Links Integration Program from FHS Team Newbie in Norway. And together with me is also a volunteer in FHS, Krisma. For
Hi.
everyone's information, FHS is an NGO which provides the information drive and awareness to benefit and help the migrant groups in Norway, gathering necessary information they need. Today, we are going to have a very special guest who will join us shortly. He's a representative of Cancer Registry of Norway, also known as Kreftregisteret in Norwegian, and he will be presenting the crucial information regarding breast cancer.
Information may or may not apply in your situation. Discretion is necessary.
Under no circumstances will our organization be held responsible nor liable in any way for any claims or liabilities resulting or arising directly or indirectly from your use of the information we are about to present. So get your pen and paper ready so we can write down all the information that you might need. We, together with the Cancer Registry of Norway, will answer your inquiries and questions at the end of the presentation. So if you have any questions, just write it in the comment section and let us open the floor.
Thank you, Florencia, for the warm welcome and introduction. Hello to all our viewers and welcome to our live event about breast cancer awareness. The aim of this DigiSeminar is to create awareness among viewers and understand breast cancer. Breast cancer is the most common type of cancer among women in Norway, and 1 in 9 women will be diagnosed with breast cancer in their lifetime. So, for those of you who are watching right now, kindly let us know which city or country you came from in the comment section below. And let's make it interactive. I know most of you are waiting for the event because the topic is very relevant. Joining us this evening is one of the representatives from Cancer Registry of Norway, and he will walk us through more about our topic for today.
Please welcome from the Cancer Registry of Norway, Dr. Samir Bhargava. He's an oncologist. Please welcome Samir Bhargava. He's an oncologist with Akershus Hospital University, and he's a researcher in the Cancer Registry of Norway, where he has studied immigrant women and the mammography program. Welcome, Dr. Samir. You may introduce yourself as well.
And thank you for the kind invitation and for giving me an opportunity to reach out to your viewers. My name is Samir Bhargava. I'm an oncologist at Akershus University Hospital and also a researcher at the Cancer Registry of Norway. Thank you.
Without further ado, we would like to give you the time to give us more information about breast cancer.
Thank you for being with us today, and we will see each other shortly after the presentation for the FAQ.
Thanks for again for inviting me, and I'm going to talk a bit about breast cancer and mammographic screening in Norway. And as mentioned, my name is Samir Bhargava. I'm an oncologist at Akershus University Hospital, and I'm also a researcher at the Cancer Registry of Norway. Could you move on to the next slide, please? So to start off, breast cancer is the most common type of cancer in the world. And in 2020, it was estimated that over 2 million people would get diagnosed with breast cancer worldwide. And breast cancer is most common among women in Northern America, Western Europe, Australia, and New Zealand. And women in these countries, these parts of the world, get diagnosed with breast cancer more often than women in other parts of the world. Next slide, please. So if you look at this map, breast cancer is the most common type of cancer in most countries in the world. In all the countries marked in pink on the map, breast cancer is more common than any other type of cancer. However, by discovering breast cancer at an early stage and with good treatment, many women survive breast cancer. And in this slide, you see that breast cancer is the most common type of cancer in most countries in the world, as represented by the color pink. And on the next slide, you will see which type of cancer that most women die from in each country. As you can see here, that many of the countries that were marked in pink on the previous slide change color, and in this slide they're marked in blue. So in many countries, including countries in Northern America, Western Europe, Australia, and New Zealand, discovering breast cancer at an early stage and a good treatment, many people survive breast cancer, and as a result, more women die from other types of cancer than from breast cancer. Next slide, please. So breast cancer is not only the most common type of cancer in the world, but it's also the most common cancer among women in Norway. And in 2021, 22% of all cancers among women in Norway were breast cancer, accounting to over 18,000 women in Norway being told that they had breast cancer in 2021. So next slide, please. So we might ask, what is breast cancer? So if we start off with the breast, as you can see here, it's an organ that consists of fatty tissue, of what we call glandular tissue, and of fibrous tissue. And when cells in the breast get damaged, usually the body will fix the damages itself and no cancer will occur. But if the cell gets damaged in a way that leads to the cells dividing in an uncontrolled way that the body cannot fix, a cancer may develop. And if we move on to the next slide. So once a cell becomes cancerous, it may divide and multiply in what we say an uncontrolled fashion and may develop into a lump. And the lump may grow in the breast or may even spread to other organs. For instance, the liver, the lungs, bones, or even the brain, as shown on the figure here to the far right. And the cancer can in this way damage both the breast or the rest of the body. Next slide, please. If the cancer is discovered early, before it has spread to other organs, as shown in the box to the left here, the cancer can be removed with surgery, and the woman who has got cancer might survive. But after the surgery, a woman who's got cancer and the cancer has been removed, the woman may still receive different types of treatment. That is, as I've listed up here, chemotherapy, radiation therapy, anti-hormone treatment if the cancer was hormone receptor positive, something I've called a bit unprecise targeted therapy, and bone health treatment to reduce the risk of the cancer coming back. So in short, if you get breast cancer, you want it to be discovered at a stage marked in the red box here. So in the previous slide, please. Before it has spread to other organs in order to have a chance to be cured. Next slide, please. If the cancer is discovered late, when it has grown in a way that it cannot be removed by surgery, or if it has spread to other organs, as shown in the red box here, someone who's got cancer can no longer be cured. However, someone who's got cancer that has spread to other organs may still receive treatment that can slow down the cancer, and such treatment, as listed here, may include chemotherapy, radiation therapy, anti-hormone treatment, and there's a bit of text missing there mentioning targeted therapy, bone health treatment, and immunotherapy. But when the cancer is discovered late, after it's spread to other organs, it is no longer possible to cure the cancer by removing it with surgery. But some women might still get surgery if the tumor is in the breast gives pain or other symptoms that are bothersome. Next slide, please. If the cancer is discovered early, at the early stages to the left in the figure in the background, before the cancer has spread to other organs, most people are cured from breast cancer and survive, as represented by the color blue in the circle on the screen. However, if you move on to the next slide, if the breast cancer is discovered late, fewer people survive. And if it's discovered late after cancer has spread to other organs, as shown in right in the figure in the background, many women will be dead in 5 years, within 5 years, as shown in red in the circle on the screen. Next slide, please. And after within 10 to 15 years, most people who've got cancer that spread to other organs will be dead. So it is important to discover the cancer before it has spread to other organs in order to have a chance to get cured from the cancer. So next slide, please. So one might ask, why does a person get diagnosed with cancer or with breast cancer? And the truth is that in most cases, we don't know why a person gets breast cancer, but we do know some factors that might increase the likelihood of someone getting breast cancer. And if you look at the next slide, I've listed up some of these risk factors. There are a lot more risk factors, but here I've listed up some of the risk factors that may increase the risk of getting breast cancer. So to start off, both women and men might get breast cancer, but the vast majority of people who get breast cancer are women. And move on to the second point. The risk of breast cancer is higher for women who are older than 50 years compared to women who are younger than 50 years old. And moving down, we see that women who go through menopause in their 50s have a higher risk of getting breast cancer than later in life than women who undergo menopause in their 40s. And further down, being older when you give birth to your first child or having few or no children is associated with having a higher risk of getting breast cancer. Moving further down, breastfeeding is considered to reduce the risk of getting breast cancer later in life. And women who do not breastfeed their children have more often get breast cancer later in life than women who do breastfeed their children. Going on to genetics and hereditary factors, it's only about 10% of breast cancers that are considered to be hereditary, and only in half of these we find known genetic mutations. Someone might have heard about the BRCA1 and BRCA2 mutations, but in half of these we don't find known genetic mutations that are known to cause breast cancer. Moving on to the point I've called lifestyle factors. Some so-called lifestyle factors are considered to increase the risk to get breast cancer. That is, for instance, obesity among women who have undergone menopause, high intake of alcohol, high intake of saturated fats, or lack of physical activity. And these factors I mentioned here is a list of risk factors that are thought to increase the likelihood of getting breast cancer. But the list is much longer than what I've listed here, and these are only some of the risk factors that have been identified. However, a person may get breast cancer without having any of these risk factors, and someone might have several of these risk factors and still not get breast cancer. And finally, at the end, I've listed up that breast cancer is more common among women in Northern America, Western Europe, Australia and New Zealand compared to other countries, which reflects the risk factors, or may reflect the risk factors that might be more common in these countries than in the rest of the world, such as the lifestyle factors I mentioned, or having a high age when you give birth to your first child, or having no or few children is more common in Northern America, Western Europe, Australia, and New Zealand than in other countries. Next slide, please. In terms of getting breast cancer, here you see an image showing some of the symptoms that you can observe yourself. Some of the important changes that you should be aware of are shown here. So starting from the top left, the changes that you should be aware of include lumps in your breast that you haven't seen or felt before, or lumps in your armpit that you haven't seen or felt before, blank or bloody discharge from a nipple, changes to the skin, including dimples or changes of the color or having thickened skin, or even sores or rashes on or around nipple, as shown in the second last photo, or even the nipple getting inverted and going inwards. If you notice such changes, please contact your doctor, who will refer you on for further examinations if needed, and that may include a mammography. Next slide, please. And mammography can also be performed as something we called mammographic screening, because there's no known ways to prevent breast cancer from happening. But in many countries, including Norway, one offers mammographic screening as a method of discovering breast cancer at an early stage. Could you click, please? And with mammographic screening, women with no symptoms of breast cancer undergo mammography in order to look for cancerous lumps that do not give symptoms. And it might, you see here that the cancer grows bigger, and the screening is supposed to detect a cancer that is already in the breast. Could you click once again, please? And in this way, one wants to, thanks. In this way, one wants to discover the cancer before it gets advanced, and in this way to stop the cancer from, to detect it early and stop it from developing into an advanced stage cancer that cannot be cured. And by discovering it early when it can still be cured, one wants to reduce the risk of death from breast cancer. Next slide, please. So when 1,000 women attend mammographic screening, 970 women will be informed that they do not have any signs of breast cancer, and they will receive a new invitation after 2 years' time if they're still in the target age group for breast cancer screening. Click, please. Out of these 1,000 people, 30 women will be called back for additional tests. Once again, please. And out of these 30, back again, please. Sorry, the other way, please. And once again. And out of these 30, 18 will have a new mammogram and an ultrasound before being told that they do not have breast cancer, while 12 of the 30 women who are called back will have to, after a new mammography and ultrasound, they will have a procedure to remove breast tissue, something that's also known as a biopsy. Could you click again, please? And of these 12 women who will undergo a biopsy, 6 will be diagnosed with breast cancer, and we consider that one of them will be what we called overdiagnosed or overtreated, a term that I will come back to in the next slide. Among the 30 women who are called back for further assessment, 24 will not be diagnosed with breast cancer and will receive a new invitation within 2 years' time if they're still in the target age group for breast cancer screening, while 6 will be diagnosed with breast cancer. Could you click again, please? Nevertheless, 2 of the 970 women who were not called back for additional tests will be diagnosed with breast cancer before it's time for the next invitation. So it's important to contact your doctor if you feel a lump, even if you had a normal mammographic examination. Next slide, please. So I'm sorry, this is a bit of a complicated slide, but the point here is to show that cancers can grow at different paces. Some cancers grow very fast and may develop between screening examinations. For instance, if a woman has been to a screening examination and a very fast-growing cancer starts developing, she might feel a lump in her breast long before it's time for the next screening examination. And such a cancer that develops between screening examinations is known as an interval cancer, as it happens in the interval between two screening examinations. On the other hand, other cancers are very, very slow growing, and some cancers might be so slow growing that they will never grow big enough to cause any harm. And when these very slow growing cancers are detected in mammographic screening, we say that they are overdiagnosed, leading to overtreatment. And this is because a woman with such a cancer will undergo surgery and perhaps other treatment for a cancer that would never have given any harm. A cancer that she would never have been aware of had she not gone to treatment. But when a cancer is discovered, we do not know whether the cancer is fast growing and needs to be taken out and treated, or a slow growing cancer. So when a breast cancer is discovered, we always want to remove it, as we cannot say what cancers are fast growing and what cancers are slow growing. Next slide, please. So when receiving an offer for mammographic screening, we encourage women to make what we call an informed decision regarding whether one wants to have an examination or not. And we want women to balance the benefits of mammographic screening, which, as shown to the left here, include earlier diagnosis, better prognosis from the cancer, gentler treatment, and a reduction in deaths from breast cancer. And for service providers, it's also important that it gives a lower cost related to treatment against the potential harms of treatment of mammographic screening, which are shown to the right, which include overdiagnosis and overtreatment, which I've mentioned, getting called back for further examinations that turn out to be normal, and anxiety that accompanies waiting for results. Some people might experience discomfort or even pain during mammographic screening. So while we do encourage that you attend mammographic screening, if you receive an invitation, it is not compulsory to attend or to go for the examination if you don't feel it's right for you. It's ultimately your decision if you want to go for the examination or not. Next slide, please. But as we see in this figure, we see the reason why I encourage that you go for the examination if you receive an invitation. The blue line on the top shows the earliest stage of breast cancer. And as time goes on, as we progress towards the right, most women who get diagnosed with early stage breast cancer survive. As we see in the blue line, it doesn't really drop down. It stays very, very high. However, as we move down towards the green, yellow, and ultimately the purple line, increasing in stage, fewer people survive. And as you see with the steep decline in survival from the purple line, representing people with advanced stage breast cancer that cannot be cured, we see that the line drops very quickly and very few people survive as time goes on. So next slide, please. So in Norway, BreastScreen Norway, or Mammografi-programmet, as it's called in Norwegian, invites all women aged 50 to 69 to breast cancer screening with mammography. Women in the target age group receive a letter every second year inviting them for mammographic screening with a pre-scheduled time and place. But if the pre-scheduled time and time does not suit the women, she can contact BreastScreen Norway and reschedule her appointment. The invitation letters are sent in Norwegian by post or to the women's digital mailbox if she has one. Next slide, please. So women who are invited to mammographic screening receive an information letter that is intended to help to make an informed decision regarding whether to attend screening or not. And you may recognize the images, the figures on the left from the previous slides we've seen here. So next slide, please. and a video showing what one can expect when attending mammographic screening can be found on the Cancer Registry of Norway's website, or Kreftregisterets website, as it's called in Norwegian. And the video is also available on YouTube. So next slide, please. The video, the invitation letter, and the information letter that I've shown are all in Norwegian. But in the invitation letter, immediately following the first heading, there is a line in English saying, "This letter contains important information about breast cancer screening. For more information in English and other languages, kreftregisteret.no/en/mammography." And by typing the link posted here, you may access the invitation letter, information fact sheet, the result letters, and handout with practical information in other languages. And if we move on to the next slide, and if you can click once again, the languages include English, and if you click again, Ukrainian, and Arabic, Polish, Urdu, and finally Somali. And currently there's also a research project going on at the Cancer Registry of Norway, where some of the women from the countries where these languages are spoken receive information both in Norwegian and a major language from their country of birth. For instance, currently some women who are born in the Philippines receive information both in Norwegian and English through this research project, while others in Norwegian only. And this is to see if more people come for screening if they receive information both in Norwegian and English. Next slide, please. And just a final slide about information in other languages to show here that the English part of the website, which you can access through www.kreftregister.no/en/mammography, it includes answers to some frequently asked questions in English. Next slide, please. In the next few slides, I want to shift the focus from breast cancer and mammographic screening in general towards breast cancer and attendance in BreastScreen Norway among immigrants in Norway. So if we move on to the next slide. The Cancer Registry of Norway and BreastScreen Norway have done several research projects to look at breast cancer and mammographic screening in Norway. And in these projects, we have shown that non-Western immigrants less often get diagnosed with breast cancer than Norwegian women do. On the other hand, immigrants from Western parts of Europe are diagnosed with breast cancer more often than Norwegian-born women are. However, while non-Western immigrants are less often diagnosed with breast cancer, when they are diagnosed with breast cancer, they're normally younger than Norwegian-born women are, and they're diagnosed with breast cancer at a more advanced stage than Norwegian-born women are. Because of this, it is quite worrying to see that non-Western immigrants have quite low attendance to mammographic screening. So I encourage people who are born in parts of the world outside Europe and North America, that especially if they receive invitations for mammographic screening, that they consider the invitation. And if one thinks that it's important to go for the examination, but the time doesn't suit, it's possible to call and reschedule. So if we move on to the next slide. Thanks. In this slide, I've tried to show a bit more about attendance in BreastScreen Norway among women born in different countries in the world. And in all the countries that I've got colors here, at least 100 women born in these countries have received invitations for breast cancer screening in Norway. And the lowest attendance is seen among women from the countries marked in red and purple. And for instance, we see that women born in Somalia, Pakistan, and the Baltic countries quite seldom attend breast cancer screening in Norway. while women born in the countries marked in blue and green most often attend BreastScreen Norway. And as we can see, the countries where people with the highest attendance in BreastScreen Norway are born are countries where breast cancer is most common. That is Northern Europe, Northern America, Western Europe, and Australia and New Zealand. While people who are born in countries where breast cancer is maybe not that common might have lower attendance in breast cancer screening. But we've also noticed that people who have lived in Norway for many years more often attend breast cancer screening than someone who's only lived in Norway for a few years. Just to summarize these two slides, that people born in so-called non-Western immigrants less often have breast cancer, but once they get breast cancer, their breast cancer is more advanced than it is for Norwegian-born women. So we do encourage that non-Western immigrants attend breast cancer screening, even if it's less common among them, because once they get cancer, it might be more advanced than it is for Norwegian-born women. So next slide, please. Well, I've so far focused on breast cancer and BreastScreen Norway. I've also been asked to say a few words about the other two national cancer screening programs in Norway, and I've received some slides from both Cervical Screen Norway and from Colorectal Screen Norway. So first, with Cervical Screen Norway, or Livmorhalsprogrammet as it's called in Norwegian, it targets all women residing in Norway aged between 25 to 69 years old. So women in target age group will receive a letter from Cervical Screen Norway when it's time to have a cervical screening sample performed. And when you receive a letter reminding that that it's time for your cervical screening test, please call your GP, or fastlege as it's called in Norwegian, to book an appointment to have a sample performed. You will either receive the letter in your physical mailbox or in your digital mailbox if you've registered for one. Next slide, please. A cervical screening checks the health of your cervix, and for those who don't know, the cervix is the opening to your womb from your vagina. And during the screening appointment, a small sample of cells will be taken from the cervix. Women who are aged between 25 to 33 years old are recommended to have a screening every 3 years, while women between the age of 34 to 69 are recommended screening every 5 years. So talk to your doctor if you feel uncomfortable with examination or if you have any concerns, and they make sure that the procedure is performed in privacy. And if you have concerns that you want a female doctor, talk to the secretary at the GP's office and ask if this can be arranged. Finally, Cervical Screening Norway have translated information about the cervical cancer screening program in 5 different languages, as shown in last line here, in Urdu, Polish, Lithuanian, Somali, and English. And you can also find information and even watch a short animation on the website sjakdei.no, which is written at the end there. Next slide, please. The third and final cancer screening program I want to mention is for colorectal cancer. And colorectal cancer is the second most common type of cancer in Norway, and it may be difficult to detect. And if detected late, less than 20% are expected to survive if it's detected after it's spread to other organs. However, if one detects it early, as is the aim of screening, more than 95% are expected to be alive 5 years after it's detected, if it's detected early. Next slide, please. The colorectal cancer screening program, or Tarmscreeningsprogrammet, as it's called in Norwegian, is a new nationwide program that started this year in 2022. The screening examination is performed by testing for invisible blood in the stool, and from the age of 55, all men and women in Norway will receive a sample kit by post, and this is repeated every second year until the age of 65. So people take the test at home. If blood is detected in the stool samples, you will be referred for colonoscopy examination at the hospital, where one through the colonoscopy looks for precursors lesions that can later lead to cancer or even early stages of cancer, and one removes them. So next slide, please. That was what I'd prepared for today, and I just want to mention that this presentation was prepared together with Solveig Hovin and Gunhild Mangerud at BreastScreen Norway. And I would also like to thank Cervical Screen Norway and Colorectal Screen Norway for providing the last few slides and information. And much of the research that I've shown, I want to thank the Norwegian Cancer Association, the Norwegian Breast Cancer Association, and the DAM Foundation for funding the research which on breast cancer mammographic screening that have led to some of the results I mentioned at the end. And I would also like to thank the Filippinske Hjelpesamfunn in Norge for inviting me to talk at this event. And of course, I want to thank the viewers who have followed this event. So thanks for listening, and back to the technical.
Thank you for this excellent piece of information, Dr. Samir. That was very thorough discussion on breast cancer. And I think at this point, we will open the floor for frequently asked questions. Chrisma, do we have any questions that we should start with?
Yes, Florencia, we do have some questions for Dr. Samir. We heard that you research about breast screening focusing on immigrants. Can you tell us more about it?
I mentioned some of the research or mentioned the research briefly in one of the slides, that we've seen that immigrant women, actually regardless of country of birth, have lower attendance to breast cancer screening than non-immigrant women do. And we cannot say exactly who has lower attendance than others, because some of the countries where women with lowest attendance are born is in Europe, some are in Africa, some are in Asia. So we cannot say that this geographical part of the world, women born here have lower attendance than others. But it seems that the countries of birth for the women who've got the lowest attendance are countries where breast cancer is not that common. And as I mentioned, women who've been in Norway for many years have more often attend breast cancer screening than someone who's been in Norway for a few years. But I think I also mentioned that one of the reasons why I think this is worrying is because even though some of the women who are from countries with lowest attendance maybe are from places where breast cancer is not that common, once people from these parts of the world get breast cancer, it's more advanced than it is for Norwegian-born women and more difficult to treat. And the risk, the chance of surviving would be lower than if it's caught early. So I would say that for people who are from places in the world where breast cancer is less common, it is still important to go for breast cancer screening because we want to stop the disease before it gets too advanced.
Excellent sum up. Definitely, we want to encourage all the migrants, females in Norway, to follow the proper screening. Thank you for your clarification. Let's move on to the next question. Why is breast screening in Norway only for women aged between 50 and 69?
Okay. Thanks. That's a good question. It's the screening age is different from country to country, and the most convincing effect that we've seen, that the studies have shown for breast cancer screening, is among women aged 50 to 69, and that is why the Norwegian health authorities offer screening to women who are aged 50 to 69. But some recent studies show that breast cancer screening might also reduce breast cancer deaths among women who are younger, say 45 to 49 years old, and older, that's perhaps maybe 70 to 75 years old. And the Cancer Registry has a viewpoint that one should consider to expand the age group that's offered breast cancer screening in Norway. So it is possible that in some years, maybe even younger women and older women will be offered breast cancer screening. But the evidence is for that it works is strongest for women aged 50 to 69. And that is why currently it's only offered for women aged 50 to 69.
Thank you for clarifying that. It's very informative for us, for all the women out there. And we still have one more question. Is the radiation dose harmful?
Um, uh, One could say that one mammographic screening examination provides a very low dose of radiation. It does involve some radiation, but it's a very low dose. And the dose that you get with one mammographic examination is smaller than the natural background radiation that we're exposed to from the environment around us during a year. So I would say that it's not a very harmful dose of radiation that one gets with breast cancer screening.
Excellent. Now we know. And the next question is related to the family history of breast cancer. When should a girl or a lady with history of breast cancer in her family should start screening?
Well, to start off, BreastScreen Norway, as mentioned, it targets women aged 50 to 69 with an average risk of breast cancer. And if one suspects a genetic disposition for breast cancer in the family, if there are a lot of women in the family who've got breast cancer at a very young age, for instance, one should discuss with one's GP, with one's fastlege, if this is something to be worried about. And the GP can refer one for the Department of Medical Genetics for counseling to see if there's any reason to be followed up differently than the regular screening intervals in the mammographic in BreastScreen Norway.
Thank you for your words. Now let's learn about the diagnostic procedure now. How reliable is mammographic screening?
Well, mammography doesn't detect all the changes in the breast, as one saw that one might go for a mammography and still get breast cancer, and breast cancer can also be found between two screening examinations, even though it wasn't present at the first one. So I would recommend that one always checks with one's GP if you notice a new lump or new changes in your breast, even if one has only recently had a mammogram. So I would say it's reliable, but it's not 100% that it is reliable to pick up lumps that you should be worried about. But if you feel a lump even after a normal screening examination, you should still seek a doctor to get followed up.
Excellent. Definitely well explained. And I agree with you that if by any means you have any doubts regarding how you feeling, no, it's important to get checked as soon as possible. So get those appointments running as soon as possible. So we have the last questions of the today's FAQ. That's something that you have mentioned during your presentation, and it was related to the first question of the FAQ. And we understand that immigrants have lower attendance to breast screening, but do we know why?
We don't know exactly why, and I don't believe that there's a single correct answer to this question, but rather different answers for each woman who doesn't attend. My impression from talking to immigrants about breast cancer and breast cancer screening is that most immigrants think that mammographic screening is important, and even though they might not attend the examination themselves, they still think that it's important. And some may not be able to prioritize the examination as maybe there are other commitments that they feel that they need to prioritize before. But in this way, they put other commitments, perhaps other family members' needs, before prioritizing their own health. So I don't think I can see how this might happen, but I don't think that's good for a woman who ends up in such a situation. While other women might be unfamiliar or even uncomfortable with, say, the Norwegian the language or public services in Norway. If you're new to Norway, maybe you don't know what to expect when you go for the examination, or perhaps you might not feel safe or comfortable going through with the examination, or for instance, the way it's performed. And I believe that every person who attends or does not attend screening has their own reason. So I think it's very hard to say why someone doesn't attend, but that there can be a lot of different factors for each person to either attend or not to attend.
Excellent. Thank you for that very honest and interesting explanation. Well, do we have any questions from our viewers, or do we have any comments that we can share with the in with? Oh, we have a very interesting
Yes, we have.
question.
Well said, Dr. Samir Bargaba. I think we have a question here from our viewers. Is it possible that we can feel any lumps or as a symptoms?
It is possible that one might have breast cancer even though one cannot find a lump or a symptom. But as I showed, that cancers can grow at different paces. So if there's a small lump that one cannot feel or one doesn't have a symptom, maybe it will just stay there and never give any problem. And if it's such a lump, it's not necessarily to remove it if it would not give any harm. But then again, if one goes to screening and one doesn't have a symptom, one might find the lump, which might be very slow growing or it might be fast growing. But when the screening is done, one doesn't know. And if it's detected, one would want to remove it. So, and in mammographic screening, one tries to look for cancer that has not yet given any symptoms, to avoid it from developing into a cancer that will give symptoms.
Excellent, Dr. Samir. It's a real pleasure to have the chance to clear all our doubts with you today. And that was our last question from our viewers. So we would like to say again that we are really grateful to have the opportunity to create this awareness space for all the migrant women in Norway. And for more information about screening in Norway, I suggest that you could log into the Cancer Registry website, and that's kreftregistret.no. Of course, as it was already mentioned, the information is available in several languages, so it's just a matter of finding the right icon to click, right? And I hope we can collaborate in future encounters, because this is a really necessary space for all the migrant women in Norway. Chrisman, do you want to say words for the doctor before we said goodbye and we send him backstage?
Yes, thank you so much, Dr. Samir Bargava, for your time. It is an honor to collaborate with you in this program, and we hope to collaborate with you again in our future projects. We are bringing you backstage now. Thank you so much for your time, and thank you for today.
Okay. Thank you once again for giving me an opportunity to talk here. Much appreciated. Thanks again.
Hmm. Well, once again, thank you so much, Dr. Samir. We are now sending him backstage. And to reiterate, we are FHS, not the members of the Cancer Registry of Norway. This program is a part of the integration and voluntary activities of our organization. Our purpose is to primarily aim at Filipinos and other minority groups living in Norway and Filipinos in the Philippines.
This DigiSeminar is a part of the activities carried out by Team Newbie in Norway. The subgroup in charge this month is called Multicultural Links. We are a group of motivated and positive individuals from all over the world, like Argentina, Peru, Pakistan, and Sri Lanka, to name a few, who work together to facilitate the integration of the minorities in Norway.
For more information on DigiSeminars, remember that you can find more topics in our official Facebook page at facebook.com/fhsorg.no and watch on our YouTube channel, The Filipino Helping Society in Norway. Visit our website as well, fhsorg.org, for more updates, other information drives, and to know more about our organization.
We also want to promote the Team Newbie in Norway's activities and programs. Spro Cafe, our monthly DigiSeminar, tips to newbies in Norway, and many more. A kind reminder that we meet in person in our physical Spro Cafe at FHS office Oslo every Saturday from midday to 4 p.m. Please check our Facebook events for more details. We warmly welcome our new sets of volunteers from Batch 8.
And if you're passionate to help and want to utilize your skills, competence, and talents in serving others, please be one of us and be part of our community. You can register as a member and volunteer for free through our website. There are several benefits for all FHS members and volunteers. Again, visit our website at fhsnorge.org.
On behalf of that Philippines Kayapasangfon Inorge, FHS, I would like to first thank the great people who put a lot of effort in preparing for this program. The FHS newbie in Norway and Jane for technical, me, Mitch, and my co-host Florencia for script. I would also like to thank you all for watching the program and making it as productive as possible. Lastly, to Dr. Samir Bargava of Cancer Registry of Norway, thank you so much for your time. Again, this is Krishna.
And this is Florencia, wishing everyone a safe, calm, and cozy Tuesday evening.
Have a nice evening, everyone.